Dear friends, welcome to my geriatric medicine channel. Today we'll learn something about obesity or the overweight. Friends, some people are obese and find difficult even to move about. What is the difference between obesity and overweight? Obesity is the most common disorder in the Western countries and among higher income groups in the developing countries also, like India. It is a condition where there is excessive accumulation of body fat. Using the data of desirable body weight for height, one can assess their weight. The weight can be classified as follows: normal weight within 10% of ideal weight, underweight less than 10% of the ideal weight, overweight greater than 20% of the ideal weight, and obese greater than 20% of the ideal weight is the definition given to obesity. Why elderly put on more weight? Causes of obesity are yet to be pinpointed. It is very difficult to note down. But the following may be considered as factors leading to obesity, like heredity, hypothyroidism, lack of physical activity, excessive intake of food, drugs like steroids, drugs for mental disorders, and insulin injection also causes obesity in senior citizens. What are the health problems caused by overweight? Complications of obesity in the elderly are many. It will lead to a lot of problems and also affect the ability quantify quality of the life due to restricted mobility. And then falls are very common in them, and depression in the society is very common. Obesity reduces the life expectancy by about 25%. Then what are the complications of obesity? Let's learn about it. Colon and prostate cancer in men can take place. Uterine, breast, cervical and ovarian cancers in women, and then heart attack is very common. Blood clot in the leg veins is very common. Diabetes mellitus, gallbladder stones, gout are very common. Gout is a sort of joint disease where uric acid accumulates in the near the joint. Then the hypertension or the blood pressure is very common. Arthritis, joint pain, other than gout and rheumatoid arthritis are very common. Impaired functional status does happen. Then the fungal infection and depression also causes in them. A low waist to hip ratio. Waist is above around the abdomen. A low waist to hip ratio protects against some of these complications. An increased waist to hip ratio suggests an increase in internal organ fat. Fat not only accumulates below the skin but around the internal organs also, which is in turn is associated with increased risk of hypertension, diabetes, heart attack, and premature death. Women have lower waist to hip ratio than men. So this is a guideline to know about the complications of and the prognosis of obesity in elderly people. Then, dear friends, sorry, how to reduce overweight death? Is there any cure for that one? The vast majority of overweight elderly have put on weight because of unhealthy eating habits. Unhealthy eating habits. Changing eating habits can be just as hard as stopping smoking. Eating habit cannot be. It is very difficult to change eating habit, like stopping of smoking or drinking also, which are also very difficult to stop. Likewise, this diet or eating habits is also very common. Principal treatment in obesity is to reduce the calorie intake. The diet of elderly person trying to lose weight should provide at least 800 to 1000 kilocalories per day. That should be noted. They should not starve. They should take at least 1000 kilocalories of food per day and should always be supplemented with vitamins and minerals, because the just 1000 kilocalories of food is not sufficient to provide enough vitamins and iron etc. to the body. That should be supplemented. Because the major identifiable cause of weight gain in the elderly is lack of physical activity. Because of lack of physical activity, an exercise program is the most reasonable approach to weight reduction. Patients should accept it and follow it. Walking 2 kilometers burns about 100 calories per day. Thus, a person, when he walks 5 kilometers 4 times a week, may induce gradual weight loss as long as caloric intake is restricted. For person with arthritis of knees, an upper body exercise program is recommended. But still, if they grumble to do all those exercises, even the upper body exercise while sitting posture, uh, it is not possible to reduce the body weight. Weight loss drugs are not recommended for the elderly. Even in younger people, it is not that helpful to reduce body weight, excepting uh, say about exercise and the diet are very suitable for them. The possible benefits do not outweigh the side effects of the drugs, the weight loss drugs. So, one should switch on to the body weight reduction through exercise and diet. It is very important and one should know about it very well. Dear friends, this is about obesity, not in detail but briefly said. Please follow it, share it, subscribe it, and like it also. Like it and share it among your friends. Ask them also to subscribe the YouTube created by me, and subscription is totally free. Though the name subscription may denote that it will cause some financial burden, it is not so. It is just a subscription. If you click that one, it will enable me to uh, create more YouTubes and enable me to give more information about many other diseases about of the elderly people. Thank you very much. Jai Bharat, Jai Karnataka.